Hi there guys, it's Zach here, Managing Director of PC Medical Support Services. I hope you're all well and this video finds you in the best state of health and happiness. Now, as part of our weekly video updates, my subject today is about chest pain. Now, the reason why I've chosen this subject is because it kind of coincides with the festive period, and the objective and the aim of this video is to get you guys heart smart. Now, the reason why I'm talking about chest pains is because this time of the year, obviously with Christmas, we do tend to overindulge somewhat. We tend to eat a little bit too much and we tend to drink a little bit too much. So that in itself can cause a manifestation in certain types of symptoms, and those symptoms can sometimes be confused with other things. That in itself is potentially very, very dangerous. Now, somebody in the UK suffers a heart attack every 7 minutes, and 73,000 people die in the UK every year as a result of a heart attack. So the important thing when it comes to the management of treatment of heart attacks is rapid intervention. Okay, you don't have time to mess around. Okay, time is of the essence, and in this type of medical emergency, every second does count. Now, let's look at the scenario from this perspective. You've got friends and family around on Christmas Day. You've got Grandad, who's probably, fought in a few world wars. He's the fountain of all knowledge. He knows everything. No one knows better than Grandad. And you've all had a massive slap up Christmas meal, and you're sat there watching, the Christmas version of, Only Fools and Horses or whatever, and suddenly Grandad's sitting there and he's like, I've got this terrible pain. Grandad, are you all right? What's the matter? Oh yeah, I'm fine. Go away, stop fussing, woman, stop fussing, I'm fine, I'll be okay. I'll just have a bit of indigestion, I'll be fine, I'll take some Rennies. I'll be fine, go away, stop fussing, woman. At the end of the day, you don't know what's really going on. At the end of the day, yes, Grandad probably has had 3 or 4 helpings of turkey and, a few extra helpings of Christmas pudding washed down with a few glasses of wine. And yeah, he may well have indigestion, but you don't know that. And to be really honest with you, neither does Grandad, because Grandad doesn't want to be a fuss, doesn't want to put you guys out on Christmas Day, and doesn't want any help because he doesn't want to ruin the day. As far as he's concerned, he's got indigestion, he'll be fine, he'll pop a few Rennies. You can't take that chance. Now, if you've got a member of your family who's advanced in age, they've got some pre-existing conditions, they've got things like diabetes, for instance, they've got a known history of heart disease, you can't take any chances. Okay, if somebody starts to complain of chest pain, it's something you need to take very, very seriously. Okay, you should be thinking straight away, could this be the beginnings of a heart attack? Now, in terms of symptoms, people will usually, they will sort of suddenly grab the center of their chest. Heart or cardiac pain as a result of heart attack is very severe. It's a crushing vice-like pain in the center of the chest. It may radiate to the neck, may radiate to the left arm or in between the shoulder blades in some cases, around the jaw area. But sometimes you won't always get those symptoms. Okay, sometimes it may just be a dull ache, which can be confused with indigestion. The other thing is that, like I said, some people will not want to make a fuss. They may just keep it to themselves. But if you notice that they have got this pain in their chest, that they're clutching the center of their chest, they suddenly start to go a funny kind of grey, ashen colour. And the thing is, if you've seen somebody like we have, having a heart attack, the colour that people go, that grey, horrible, ashen appearance, it's like looking at the face of a dead person. You will not forget it. They may be short of breath, they may be sweating, you know, they may be very agitated, they may have what they call it an impending sense of doom. Some people will say, I think I'm dying. You know, these symptoms are all classic symptoms of a heart attack. And you may have some people that have got a pre-existing heart condition. They may have angina, which is a narrowing of the coronary arteries. Exertion and things like that will cause the coronary arteries to narrow, which will cause breathlessness and pain. These people will usually wear what's called a GTN patch. They will carry GTN in a spray, which effectively is a medication used to dilate the blood vessels. The thing is, you can't automatically assume that they are not having a heart attack. So if they take their GTN spray and the pain doesn't subside, that should be ringing alarm bells in your head. Okay, somebody that suffers from angina will be able to differentiate between the pain of angina and something else. They will say, this is not how it normally feels, this feels completely different. The thing that you need to do is you need to dial 999 immediately. Do not allow that person to collapse and then go into cardiac arrest, because now you've got a patient that is dead and is in big trouble. And if you're somebody that isn't trained in delivering CPR or is not confident in delivering CPR to a person that is in cardiac arrest, that person is in big trouble. The survival rate of out of hospital cardiac arrest is less than 10%, and after about 4 minutes of not being adequately resuscitated, you know, that person's chances of survival diminish by 10% after every minute of not being resuscitated effectively. So time is of the essence. Do not mess around. Do not mess around with chest pains. If your relative is complaining of pain in the chest, or they've got these other symptoms, and they are in a group, an at-risk group, if they're a bit overweight, if they don't exercise, if they've got diabetes, if they've got pre-existing heart condition, or they've had a heart attack before, they will know, because they'll be able to tell you that this is a heart attack. Do not allow Grandad to tell you what to do. If you are worried and you think something is not right, dial 999, ask for an ambulance. The most important thing is to have Grandad sat around that Christmas table next year. You know, you don't want, you know, someone to pass away on Christmas Day. It's an awful thing. It's something that we don't want. It's something that certainly you don't want. So that's all I've got to say. Get heart smart, and more importantly, get yourself trained in basic life support and first aid. Make that a resolution for 2017. If you're not first aid trained, get first aid trained. Get trained, get smart, get confident. That's what we always say to people. That's pretty much all I have to say. From all of us here at PC Medical Support Services, have a fantastic Christmas and a prosperous New Year, and we will speak to you very, very soon. Take care of yourselves and each other. Bye now.